Thank you, Becky. And I just want to extend a very warm welcome to everyone joining today's session. And this particular session is focusing on what will research practices look like in 2031. And I've just got a little warning on my screen to say my internet connection is unstable, so I really hope it stabilizes. So I'm Sarah Miller, as Becky said. I'm Professor of Education at Queen's University Belfast, and I've led many RCTs in education, some of which have been funded by the Education Endowment Foundation, and I also sit on the EEF's Expert Advisory Group. I have a strong interest in systematic reviews in education, and I belong to the Campbell Collaboration, which is how I know of Elizabeth's work, and I'm delighted to be able to chair today's panel. So my role is just to facilitate the conversation between our keynote speakers and to field any questions that you might have for either or both of them. So we've set aside some time at the end for this purpose. So if you do have questions, as Arno said earlier, please do pop them in the chat or raise your hand when we get to that point in the session. So without further delay, we'll introduce our two keynote speakers today. So Dr. Elizabeth Tipton is an Associate Professor of Statistics and the Co-Director of the Statistics for Evidence-Based Policy and Practice, the STEP Centre, and a Faculty Fellow in the Institute for Policy Research at Northwestern University. She's board member of the Society for Research on Educational Effectiveness and recipient of the Frederick Mustler Award from the Campbell Collaboration and Early Career Awards from the American Education Research Association, the American Psychological Association, and the Society for Research Synthesis Methods. Elizabeth, you're very welcome. And we also have with us today Professor Brian Nosek, who is co-founder and Executive Director of the Centre for Open Science that operates the Open Science Framework. It's a collaborative management service for registering studies and archiving and sharing research materials and data. So the Centre for Open Science is enabling open and reproducible research practices worldwide. Brian is also a professor in the Department of Psychology at the University of Virginia, and in 2015 he was named one of Nature's 10 and by the Chronicle for Higher Education's Influence List. So welcome Brian, and welcome Elizabeth. Who I might accidentally call Beth. I hope that's okay because I know you as Beth. So you are, oh great. So you're very welcome, delighted to have you with us. And that is the most speaking I'm going to do, I absolutely promise, because it's over to you. So one of the things that the EEF has been reflecting on in terms of its 10-year anniversary, which I can hardly believe because I feel like I have grown up with the EEF since it started all those years ago. But one of the things we wanted to explore with yourself and Brian is what you consider to be the main innovations over the last decade in terms of, particularly in relation to randomized controlled trials and quasi-experimental research methods. So I'd like to turn to both of you actually, and I'll turn to Brian first. In terms of, do you have sort of any examples in your mind in terms of those innovations that really sort of stick out in your experience over the last decade?
Thank you, and thank you for inviting me to this event. I'm delighted to be part of the discussion. From my perspective, the primary innovation from the last 10 years on these issues starts conceptual, and that is the recognition that longstanding challenges that we have for research credibility. We've known about publication bias for a long time. We've known about various questionable research practices that reduce the diagnosticity and meaningfulness of the evidence that we produce. We know about misuse of statistics and poor inferences based on that. Those are things that we've understood as problems. And we've even, if you read methodology papers from the 1960s and 70s, we know what the solutions are and have known the solutions for a long time. So the innovation, I think, over the last 10 years is recognition that the reason that those behaviors persist in our practice is not really a function of lack of knowledge or even lack of motivation. It's that it's a systems challenge. It's that we've structured a reward system, a reporting system, evaluation system that advantages people and actions that result in, ironically, reducing the credibility of the evidence that we produce. So that's one at the big picture of just an understanding that in order to tackle these issues, we need to adapt our policies and our practices by treating it as a systems problem to solve, which is very much in line with the things that EEF has done in terms of implementing its own policies and practices, is recognizing that. And so changing the requirements for what needs to be done. The second factor that at that conceptual level, and I'll stop and then we can talk about particulars as the back and forth, is recognition that this is not a problem that can be solved with retrospective work. Like, all right, people are just going to do their work, and then at the end, we'll figure out, we'll make adjustments so that we can aggregate the data sensibly. We'll be able to make sure that they just report transparently what they did. Rather, the solutions have to be full research lifecycle solutions. We have to start at the beginning, because if things go wrong at the beginning, those are in some cases uncorrectable. And if we don't have transparency from the entire process, then the things that drop out will bias the resulting evidence in ways that we can only estimate to correct rather than actually address. So those as the conceptual recognitions, I think, spawn a lot of the individual practices that have emerged that I suspect we will wrestle with. So I'll defer to Beth on next.
Thank you. Beth.
Brian, thank you. I'm not sure what I'm going to say is going to directly connect to what you said, but I love the systems framework. And that's something I'm going to keep echoing today as well, is that I think we have to think about this research in a systems way, instead of thinking about it as individual studies. And so I just want to echo that. I like that. I actually wanted to just start by saying, you know, that one of the first innovations is that we can actually do RCTs and high quality quasi experiments in schools. I think it's easy for us now to start critiquing that and to think about how to expand those. And I spend a lot of time thinking about how to make them better. But I think sometimes, you know, it's worth taking a step back and saying 10, 20 years ago, the idea that you could actually go into schools and do this kind of work, people would have said that's impossible. So I think just the mere fact that we're doing this work is kind of revolutionary. I too, Sarah, think of myself as growing up in this system. I started graduate school 15 years ago towards the beginning of what was the Institute of Education Science funding in the United States. And so I've watched the field sort of grow, and I've grown, you know, I've been thinking and growing within that framework for a long time. And so one of the things that I think I've noticed over the last sort of decade, as the field has stabilized, we now know how to have, you know, what is the right sample size that we need to have, for example. You know, how do we adequately power? How do we think about outcomes? You know, just some basics that took like a decade to figure out. In the second decade, I think that we've encountered a lot of questions about external validity and about thinking about the connections between these studies and practice. And so now we can do RCTs, but, you know, how do we get the results of these RCTs into the hands of people who are going to make decisions? But also, you know, are the RCTs and I'm going to keep saying RCTs, but I also mean quasi experiments, high quality quasi experiments, but how do we make that connection between practitioners and RCTs? And some of that is about translation to them, but the other part to that has been about making sure that we're studying the broad population. So I think there's been a lot of innovation over the last decade in thinking about these questions of generalizability, but also questions about treatment effect heterogeneity and trying to understand if treatment effects vary or not. And actually this does connect to Brian, because the questions of treatment effect heterogeneity are often very exploratory. And so, you know, what often happens is that people plan their study to look at an average treatment effect. It doesn't turn out to be very big. And so they move on to thinking about subgroup effects or thinking about if there's any moderators of that effect. Well, even if the average treatment effect is causal, those moderator effects are not causal. And now we have this problem of just trying a lot of, p-hacking, of phishing, all of these statistical problems come into play. And so being able to pre-register, for example, those hypotheses and being very open about what was tested and what wasn't tested is really important. So I think these are emerging areas. These are areas in which I think people have been thinking a lot. The other place that I'd like to highlight, so you framed it to me as a question about social sciences. And so I was thinking, what are areas that there have been work that we're kind of not seeing in education, but we know exist elsewhere? And so I thought of a couple of those. One of those is, outside of education, there's been a lot of work in big data. How do we scrape data? How do we study corpuses of text? How do we look at backend data in web applications? Conducting A/B tests in those environments. We haven't seen that much of that making it into education, but I would hope that we will, because the methods are there for the most part. It becomes a question of what data do we have available, and maybe that ed tech products are one of the areas in which some of these methods will be able to be used. But I would also expect that even just studying administrative data and understanding sort of descriptively what trends there are in administrative data, hopefully these methods can be used for.
Thank you. And I mean, you mentioned administrative data, and there's such variety and variations in terms of what data are even collected. I mean, even within our 4 nations in the UK. Brian, I don't know whether you want to reflect back on anything that's that Beth has just mentioned. It sounds like we have come a long way in the last 10 years, and I would certainly agree with that. Do we just need to keep going, or are there, as we think about how we look to the future, then what are the key things that we are going to need to address? Do we also need to do what we're doing, but do it better and continue to do it better? Or do we really need to be kind of looking to those kind of more innovations, and where do you perhaps see those innovations coming from? You've started to allude to some of those in some of your responses to the previous question. Brian, if I can hand back to you.
Certainly. Yeah. All of the examples of practice that Beth raised, I think, are important, and, continuing on them are like, well, of course, now we have some insight on how to do this better. Let's keep doing that. And simultaneously, all of them can be improved substantially. So pre-registration, data sharing, aggregation, synthesis methods, we're not done in how it is we can use those effectively. How it is, for example, we can use pre-registration iteratively for these longitudinal trials where you don't have all the plans at the outset, but you can effectively do updated planning as new insights come to fore, and make adjustments when needed in terms of the statistical or inferential confidence that you make in those events. So there's lots of continuing improvement to make. When I was thinking about this particular issue in a broader context, it feels to me like there are some strong parallels emerging for what is coming in this kind of work with what biomedicine has faced in the clinical trials pipeline. So, and that work is maybe 20 years ahead of where it is here, right? In pharma's recognition, right, there's huge conflict of interest. So the idea of registration and having all trials be reported and otherwise emerged primarily as a financial concern, like people are going to p-hack so that they can make $1 billion. Seems kind of obvious, rather than a concern about rigor and just improving effectiveness overall. Of course, those were concerns, but it wasn't driving. So as clinical trials became more standard in being registered and improving the rigor of that work, that has dramatically improved. And there's still lots of things to improve in the clinical trials pipeline, but obviously we have direct evidence in the recent years that this has actually gone very well in improving research practice there. But what also has emerged as insights is how much waste there is in clinical trials, in doing randomized trials, because of poor rigor earlier in the pipeline. the preclinical and basic research that feeds those trials. So what do we decide to do an RCT or a quasi-experiment when it's not possible on? Right? That comes from that early stage work of seeing what's promising and what seems likely. And there is stunning evidence from different areas of practice in biomedicine for huge amounts of waste, right? ALS is an example. Lots of trials and potential targets of therapies for addressing ALS. They all fail, every single one. Like, these reviews are maddening of, here's 12 RCTs we did on drugs, all are ineffective, right? Based on what has seemed to be strong preclinical evidence of, this works in mice, this seems to have some viability here, it's ready to move to trials. So I think the parallel here is that as the rigor has improved, and I think Becky even pointed to this in some of her early comments, is what we find is that a lot of the RCTs fail. And what's ambiguous is that a challenge of translation to practice, or is it that the actual evidence that justified doing the RCT in the first place wasn't strong enough to justify doing an RCT? We are just completing a replication project in cancer biology. The meta-analysis should be submitted, in the next couple of days, of the 7 years of replications across preclinical cancer biology, and the findings are stunning. Right, we have very difficult time replicating these basic research, which these were all preclinical work done in 2010 to 2012. Many of them did turn into trials. Many of them launched startups, et cetera, et cetera. But the evidence of our replications of these 50 experiments, the effect sizes were 85% smaller on average than the original studies. Like, what are we talking about here, right? Even if we say those are real effects, right? An 85% reduction now has a very big implication for translation. What is that going to mean in therapy? Or what's that going to mean in the classroom? So I think that is the next phase of this, is the challenge of effectiveness really should make us look further earlier in the pipeline for what we decide to do.
Thank you, Brian. Beth, is there anything you want to come in on there?
Yeah, Brian, I have so many things I want to connect with. Again, I've been trying to retool what I was going to say to connect with yours, because I think a lot of what I've said, what I've been thinking about for the future is very much embedded in what you're saying. So I have maybe 3 things that are connected to, if I reframe this a little, to what you're saying, what you're talking about. I think the parallel to pharmaceuticals is a really smart parallel, and there have been some innovations there that are, that have happened earlier, for example. So one that I want to raise is that in the U.S. context, at least, there's been NIH had this sort of, I think it was a congressional act that required them to start including a broader range of people in trials, and so it was called improving across the lifespan, or evidence across the lifespan. And so the general idea is that clinical trials were excluding people below the age of 18 and people above the age of 50 or 60. And yet those are the 2 populations that often that need evidence of effectiveness of drugs. And so this was pushing people to include children and geriatric populations in research. I think there's similar work there that needs to be done. I mean, there's similar things like that need to be done in education. So I have worked with colleagues where we've looked at, in the US context, the kinds of schools that take part in studies. And they tend to be schools that are they're close by to researchers. They're in urban areas right next to where universities are. They're often the same schools used over and over again. They're increasing, they're not connected to the population in a clear way. And so I think one of the things moving forward is sort of taking that idea of thinking about the population seriously and making sure you're representing the population that will use this evidence in the trials is incredibly important. Another connection I wanted to make, and I think I'm going to frame this as being a question of basic versus applied science. is that I think that this is true in the US context as well, is I think that the education, the sort of way we have framed this research kind of has come out of a basic science approach. And as we've been doing the work, we're realizing the sort of parts of that that don't work. So Becky Francis, you said, for example, this like every flower, letting every flower bloom kind of approach. That's what basic science does, right? It just sort of says like, let people come up with innovations and let them test them in the field. But I think over time, as we realize we're wanting to use this as an evidence system and we want people to use the evidence, that's frustrating because maybe researchers are like growing flowers in all sorts of like little pockets, but not actually in the big field in front of us that we need flowers in. And so I think some of that is about sort of directing research as I think about where we're headed in the future, is that if this is an applied science and really is about getting evidence to researchers, then we have to be a little more directed in sort of collecting what we know and then figuring out what we don't know. And there needs to be a feedback loop in that system. And this is a nice connection between the sort of RCTs, quasi-experiments, and meta-analysis, right? And gap maps, evidence gap maps over on that side, right? So it's like, we need to be a full feedback mechanism where we're conducting trials, collecting all of that evidence, figuring out what we know, what we don't know, and then feedbacking in, this is where we need to have new trials. These are the new studies that we need to have, instead of letting that just be generated by researchers. And I would connect further to that, as COVID has made it really, I think is going to make it hard to do studies. I think that as a result of COVID, schools are going to be really pressed with problems. And you can think of this as like a difficulty for us as, as scientists, that it's going to be harder to get into schools potentially. But I actually think it's a little bit of a gift in that it's going to make us have to think carefully about innovations that are really relevant, because schools are only going to want to be in studies that are truly relevant to solving problems. And so again, as part of this like feedback mechanism, we need to know what are the problems schools are facing. And maybe they're not like the fun problems for us as researchers. Maybe they're about transportation. Maybe they're about school lunch. Maybe those are not the most exciting things to the people that are currently in the education system doing research. But if those are the real problems that schools are facing, and those have real consequences, then maybe we need to be bringing other people into the education fold. Maybe we need to be, shifting our research focus a little. So I think there's just this connection between practice and relevance that is incredibly important. And then the last thing I wanted to say, to connect back to Brian too, is this connection to sort of the development studies. So I was, as you were talking, I was like, yes. And then you said mice. And I was like, right, I forgot about the mice in pharmaceutical trials. But I think that there is actually a parallel here, which is often people develop interventions and they do it in like 1 or 2 schools. And they do it with like a lot of researcher focus. They've got real buy-in. And then when we bring them to scale, what do we find? We find that they have huge implementation failures. And then we think of that as a nuisance. Like, oh, people aren't implementing it. So is it the average treatment effect, or are we interested in the intent to treat or the treatment untreated, et cetera? If only people would implement this well, then we could use it. I actually think that that implementation problem is our problem. Like that should be our focus right there. If you can develop a reading program and it's a reading program that does not authentically fit within schools and how schools work, it's not going to be implemented well. In which case, why are we even like bringing that to trial? So we need people earlier in the pipeline to be thinking about what happens in real schools and making the interventions really contextually work in those schools. That may mean in development studies, making school, maybe you don't only look at 2 schools, you look at 4 schools, and you look at really different kinds of schools that you're checking it in, and really paying attention to implementation. But to me, the innovation, the intervention has to be how to get teachers and principals in school to do this practice, not just the practice itself. And I think until we take that really seriously, we're going to keep coming up with innovations that work in our heads and work in the ideal, but that just don't work in the real world. That's all.
That's great. I have two reactions to things that Beth says. Such great comments. On the last one, keep pulling on that biomedicine parallel. There's an entire subdiscipline in biomedicine, health services research, that's all about implementation, right? How do we deliver the drugs into the arms? What systems do we need? What processes? How are we going to do that and do it well? All this stuff. So that, I think, is a critical point. And then back on your point about basic to applied and the reflecting back of what the problems are that are really on the ground that should be driving the research agenda. I think there are untapped potential in this area to do things like, for example, DARPA does in the US. We have been involved in a few DARPA programs now organizationally, and it is an entirely different approach to driving the research agenda, where they say, this is the problem we want to solve, right? And mostly it's things like walking robots and whatever things that they're doing, but they also are interested in social science problems. So the problem that we're working on in the SCORE project, which is a big program that they are supporting, is we're trying to create automated indicators of research credibility. Can we get machines to give scores to papers to say, heuristically, first pass, this is how much we think that you can trust this evidence, right? That's a crazy up here kind of problem, but it's a very directed problem. Can we create that? And so the entire program and all of the researchers that are involved are oriented towards, let's see if we can solve that problem. And it just changes the orientation of research engagement with it. And we've done a couple on my substantive research, my area is implicit bias of research. And we did some things that were sort of this DARPA inspired. So we organized a contest where we challenged researchers in our research area to say, can you reduce implicit race bias the most compared to others? We're going to give you 5 minutes. You're going to do whatever intervention you want in that 5 minutes. And we're going to run a randomized trial of all the interventions, and it'd be 17 different interventions. And we're going to see which one wins. And then we did multiple rounds of this contest where all the teams got their results, said, oh, we can do better than that. And so they adapted on the fly. But this comparative work and the focus on solving the problem, not figuring out what the theory is for it, let's just kitchen sink it. Let's just solve the problem. Totally changed how people oriented to the work. And so I think that it's not one or the other, but both of these can really leverage changes in how we focus on the problems that really need to be solved.
That's great, Brian. That's exactly right. Like I like the DARPA connection. Do you mind telling me what the DARPA, or reminding everybody what DARPA stands for? Because I'm afraid that I think I know, but I want to make sure I do.
Yeah, it's the Defense Advanced Research Projects Agency. So it is the research arm of the Department of Defense in the US. So they built the internet, but they also build like bombs and stuff that.
Right, good stuff, bad stuff. Right. I agree, though. This idea of directed research, I think, is really important, and I think there's two parts to that. One is that it's directed, and the other is that it's problem focused. So it's like saying to the field, I want to know how to make this gap between, I want to close this gap, or I want to improve the way that kids read by 3rd grade, and I want to, like you're sort of saying, you're hanging this like little carrot to people. I want you to do this. And you're gonna, who knows who you bring in. Maybe it's different people than you have in the system already. Maybe it's the same people and they change what they're researching, because honestly, researchers follow money. But it becomes, very systems focused. These are the things we need to know for the amount of money that we have. And I would add to that really fast, just a second, Brian, because I can see you want to say something.
No.
I think that owning that we only have a certain set of resources is really important in this system, because it sort of makes you make trade-off decisions. Do we want to know a lot about one topic, or do we want to know a little about a lot of topics? That's up for you to decide, but that requires you to admit, if we were planning the next 10 years and the next 100 studies, and we only have a certain amount of money for that, optimally, how would that look? What would that look like in 10 years if we knew, for that amount of money? We can't study everything. We don't have all the money in the world, and we don't have all the time in the world or the number of schools in the world. So we have to really think about how to optimize where we spend that money and spend that time.
Yeah. Yeah. And, on that, I totally agree that on that point on, we want to get those kids to read. Of course, that's the motivation of a lot of researchers that are developing reading interventions. But when you reverse the orientation and you say, okay, we want you to do whatever it is you think will maximize reading, but here are the 7 other teams that are also doing that. And we're going to see how well yours works against theirs.
Mm-hmm.
The orientation change is dramatic because, oh no, I was focused on this little part of the problem. Really, the problem is the school lunch. That's what I think the problem, right? So they totally shift their emphasis and approach and strategy because, oh, I don't want to lose. I do actually want to solve the problem, but because I was thinking in my theoretical orientation, the parsing out the pieces of trying to understand what actually works and the mechanisms, I lose sight of the bigger picture of what it is that I'm actually trying to solve, and then pull in a diverse team because I know that will work. I know all these other parts are needed. That's just not the part of the problem I'm studying.
Yeah, I think that's a good point. The bringing in bringing in a team, some of the best experiences I've had sort of in research have been when there has been a very clear problem and the team around the table are from all sorts of different fields and perspectives, and thinking about how to bring together all of those different perspectives to really focus on this one problem. How do we design this study to answer these questions? And to do this well. I think we need more of that, and the problem focus really makes that possible, because if it's coming from, otherwise it's coming from the field, and then you're bringing in other people as, sort of just as advisors, or for, it's led by one of the fields. But when it's problem focused and you've got this result at the end that you're really trying to prove something or to see if you can make it better, everybody really has to come to equals.
Yeah. And it's easier for the psychologist to understand what the economist brings to the table, that the sociologist has an insight about that. Oh yeah, we do need to understand that, or whatever.
Yeah. If you're focused on solving that problem, then you're willing to sort of listen to those.
Otherwise, I am not interested in what the economists have to say.
That's exactly right. That's exactly right.
I think there's lots of people who will really identify and align themselves with what you've both been saying, as we've all been involved in trials that are not necessarily sort of yielding the effects that we might otherwise have seen. And you've offered some solutions as to how we maybe start thinking about that in a more systematic or a larger framework. And, by bringing in different perspectives, which we are all starting to do, but could absolutely do better. And also by being problem focused. And I think certainly unnecessarily in the last few years, we've been very focused on getting the trials right and how we do that right, and how we do generate credible, transparent evidence. But if that's all revolving around the wrong solution to the problem, then that's problematic. So I think we've got a lot more to do there. So you have kind of sort of suggested some ways forward in that kind of conceptual way, and I think many of us would really welcome and embrace moving in that direction. In terms of technically, in terms of the types of sort of studies and designs, how we've been conducting our experiments. Beth, you referenced COVID, and actually the practical side of getting into schools is changing. We've all had to really pivot, in order to generate the data that we have, wanted to generate. Is that going to stand us in good stead, or what are we going to be trying to do differently and better and more elegantly? I suppose learning from our more learned colleagues. I'm not a statistician, but I use statistics. And so, bringing everybody along with us as well, so that we can all kind of do things better. That was a very long-winded question. So absolutely, I mean, whoever even gets anything out of that, well done.
Thanks, Sarah. I'll try to start. I think thinking technically moving forward, I think we have a lot. I'm trying to think of I think we have a lot of innovations right now that just aren't being necessarily used yet. And so, one of the places, I guess, to start there is, if you've got, in the US context at least, we've got 20 years worth of methods that have been developed in these trials, for analyzing trials. I think some of it is turning those from retrospective methods into prospective, in the sense of moving forward. Let's say we know how to analyze data from the past, but what would that tell us about a new data point? What should the next data point be in order to analyze, in order to even have a stronger analysis? So that might be, we need a larger study. So we need a second study that's the same size, so that we have enough evidence to be able to compare. Or it may tell us that we did a previous trial in an urban area, and that in order to answer questions about sort of heterogeneity and the robustness, that we need to actually plan the next trial to be in a rural area. So these are sort of like turning the methods that we now have that go back retrospectively, kind of like, meta-analytically even, to asking where, what those tell us prospectively about where to do studies. And if we had that data, maybe that would make our estimates more precise. Maybe it would allow us to look at nonlinearities. Maybe it would allow us to answer questions about interactions, but that without a new data point in this particular quadrant, we're not going to be able to do that. And so I would say, in some ways, I don't know that, this is bad for me to say as a methodologist, right? As a statistician, I don't know that we need that much more research. We obviously do, as new data sources come out, and COVID's going to lead to lots of missing data problems and lots of new methodological problems for us to solve. But in some ways, for those in the field, I think it's about, a lot of what I have to say is about study design and about how to anticipate, I want to use these methods. These cool new methods exist. They allow us to answer questions, but they only exist if you have the data. And so you need to have the data to be able to analyze it. And some of that, I was just thinking too of Brian, what, talking about these teams approaches, is that, one of the obvious ones is that you have to all have the same outcomes measured in those mini studies in order for you to test head to head, do those work? I know in the US context that can be hard because researchers like to have their own measures. And so making sure that you have some sort of common measure that everybody is using so that you can equate studies, and compare studies with each other. So some of it, to me, there's a lot of questions that in the future that are really just about data and making sure that if you think through from beginning to end what the analysis is that you're going to do at the end, and you can kind of probably imagine that more now than you could 10 years ago, right? Because you've got some studies. What are the gaps? What are the problems? If I'm trying to do a meta-analysis of this, and my problem is that, only some studies collect this variable, only some studies report this outcome. Well, that tells us in the future that what we need is to actually align and collect common outcomes. It may tell us, well, when I try to do this and I look at moderators, I don't have much variation in in the age group, et cetera. Well, this tells us in the future that we need to sort of try this kind of intervention in a broad range of ages. So there's a way in which it's not just do the meta-analysis at the end, it's sort of do the systematic review at the end and really do it with a mind towards these gaps. Where are the gaps? And use that to anticipate and design better studies in the future.
Yeah, I think those are great points. And, a real challenge that we have is that the way we fund and do and report research is lots and lots of small studies and hope that aggregating them at the end is possible and provides the insights on the nuances. When we know already that each small study is not sufficient to examine the heterogeneity that we need to examine, to test the interaction effects that we might want to test, to even just have the generalizability in terms of scope for the problems that we're trying to investigate in schools or with teachers, or especially given all the nesting that many of the questions that are investigated. So if we're really going to tackle those problems, it needs to be a reorientation to how we think about resourcing and conducting the research process. And one example of that is the registered replication report model that AMPS does. So AMPS is the Advances in Methods and Practices in Psychological Science. And the approach there is, if we're going to replicate important findings, really we should lean in on these challenges of investigating heterogeneity, of seeing how it plays out in different samples and settings. So what we'll do is a lead team will propose a protocol. Here's the question, here's the design, here's the research that we're trying to do. This is why we're trying to do it. And then we will publish the protocol and invite proposals for different teams to join the protocol and do the data collection in their setting. And then everybody is a co-author. This is both a research model and a funding model, right? And it can change the orientation of how researchers think about their contributions. We can do fewer, larger studies and get a whole lot more definitive insight, where we're essentially doing the meta-analysis first because we recognize it's an important problem. That's the project. We don't need to aggregate additional evidence. We're getting all the evidence. And it's all in a common protocol. So I think testing some things like that, right? Here's a problem that we know we should do it, trying it out, piloting it, seeing how it goes, can then stimulate lots and lots of innovation in how we think about extending that to solve more problems.
Yeah, absolutely. And, how do we bring those people who are going to pay for that funding or that research, along with us as well? We need to be sort of...
What ends up happening is it ends up being a lot more research dollar efficient because, right, if you do lots of small studies, you still have to have all of that work on design, on recruit, all of the things that go into the initial protocol. When it's just data collection, you're going to fund my lab to collect the data. Beth's lab is the one that designed the whole thing. Then I can do that, right? I can just charge you for the amount of just executing the study. And it becomes pretty easy comparatively to get the kind of data that you need.
I had one last thought too that I just wanted to bring in for things to study in the future, I guess. All of our way of thinking about evidence supposes that our job is to supply evidence and that there is a demand for evidence. Now, this may be different in the UK context than in the US, but in the US context, I think what we're grappling with right now is that there is not really much of a demand for evidence. And so, we think of ourselves as providing results from these trials, and they're going to really have a big difference in schools, and they're going to make decisions related to that. And then in the little bit of research that has gone into schools to sort of see how people make decisions, nobody knows what the What Works Clearinghouse is, for example, or they don't really use the online version of the WWC. They tend to want to use practitioner guides that are more sort of, that really have more words in them, not just data, but words that sort of help guide people into what the best practice is. And so so thinking about that, you can actually think of that as a little bit of an intervention in itself. Like, how do you teach people that they need evidence? Like, there's a whole stream of research that could be done on just this alone. How do you teach people in schools that they need evidence, and that what is evidence? What constitutes high quality evidence? Because the reality is that we have enough evidence in our system that everybody wants to say that they're evidence-based. So even an intervention, a product that has not been rigorously tested will still market itself as evidence-based. It will use scientific language and use some of the language of statistics. And so, I can see how we're telling everybody you should use evidence, and there's some people who are over here like science focused on really high quality evidence, and we're arguing about, is this biased in this way? Is it biased in that way? And are our standard errors correct? And at the same point, you've got a system in which somebody else can just like create something and throw together a flyer that uses some of that same language. And I'm not certain that sort of regular practitioner people, people on the street can tell the difference between those two. And so I do think that if what we want is for people to be using evidence, we need to actually take seriously, what is there a demand for evidence? How do we make that demand for evidence? And how do we help people in that decision-making process understand what is evidence versus what is not evidence? And without that, we can create a beautiful system of evidence that nobody uses. So I think we have to really, take that as part of our job. It's probably frustrating to funders because, what funder wants to study how to make people use evidence to solve this system. But I do think that maybe that is an innovation that would actually solve a lot of educational problems, is if people at schools could actually tell the difference between sort of fake news and real news.
Oh, and I think that just is something that we've all really been thinking of, ourselves. And I know that's a key challenge for the EEF. We've done, great work in terms of connecting evidence to practice, and obviously that's an ongoing thing. But those are some, absolutely helpful insights there. In a minute, I'm going to ask people if they have questions, but I just wanted to turn to you, Brian, and then again, Beth, just to see if you have any kind of closing things. I didn't even get to my question on what we shouldn't be doing, but anyway, we'll save that for another time maybe. But Brian, is there anything you want to kind of say that maybe you haven't had the chance to say yet in closing?
Just very briefly, any innovation will have unintended consequences. So if we don't build in evaluation of how these changes get implemented in our research practices, then we'll end up producing other problems that we didn't anticipate. And so having an evaluation system that is part meta research about the processes that we're implementing, about how pre-registration works or doesn't, data sharing, these different designs is a critical part, I think, of any change management process for improving our research practice.
Yeah, and I think it speaks as well to the range of data that we need to collect to be able to answer all of these questions. It's not just about what works, but there's a whole host of other questions that are important for us to answer to understand why things are not working. Beth, I'll just come back to you finally.
Yeah, I mean, I think I've said it before, but I'll say it again. I really, the systems perspective. I think taking the perspective of we have 100 trials. What are we doing in our next 100 trials? We have a limited amount of money. We have a limited amount of time. If we want people to use evidence, and then we need them to be encountering evidence in a lot of different places. And so how do we design that carefully and prospectively so that we can do the analyses at the end that are answering the questions that are really pressing in schools?
Yeah. Thank you both so much.